living with Parkinson's. You just watched him in action on Designated Survivor.
Did you know that Michael J. Fox was diagnosed at just 29 years old? Man, man, he's been fighting this disease head on. And so do people living with Parkinson's right here in Baltimore, thanks to some amazing advancements.
Before I retired, I worked for an air conditioning and heating outfit. So I did a lot of work with my hands, required me to be physically flexible and so on. I've lost a lot of that with the Parkinson's.
I have to take time to think more. I lose my concentration and have to slow down with my words. My tongue gets jammed a little bit. So I have to be very careful what I'm saying.
It slowly starts to take away movement. It happened to John Dunnock. He started noticing 9 years ago. It was 14 for Ken Cochner. For John, it started out with a small tremor, but it slowly progressed.
I don't have the durability or the endurance that I used to have, nor the coordination. So a lot of the things that I normally do around the house and the yard work, I can't do anymore.
And for Ken, it was his wife who noticed the change.
I would say 6 months. I didn't know what was happening, but he would walk into the room and kind of freeze before he would walk forward or decide where he was going. So I thought, something's wrong.
But today, both men are gaining back parts of their lives, all with the help of LSVT, big and loud, at MedStar Good Samaritan Hospital.
So it's very intense exercise, a little bit different from what they're used to doing. I want you to reach out big and open those fingers wide.
The program is backed by 20 years of research by the National Institutes of Health. There are 2 parts. Big is movement.
We're addressing deficits in their posture, deficits in their walking. People with Parkinson's tend to move with smaller motions. They take smaller steps. Some may have shuffling gait patterns that we see, or they have a posture where they're kind of, scrunched forward a little bit. 6, 7.
I think I have in my flexibility to what it was before, and some of my awareness on what I need to do to protect myself from dragging a foot and tripping over a step, something of that nature.
The other part is speech.
Patients with Parkinson's, typically one of the main speech characteristics is low volume. So what the Loud program does is we practice teaching folks to target that effort or that loudness that they need.
People were able to hear me. That was a major part. I had people asking me all the time to speak louder, and I couldn't do it. So I was speaking loud, but I wasn't.
Each patient goes one-on-one with a certified therapist 4 times a week. And then they take what they learn home with them.
It takes the burden off of us because we're prodding, suggesting, coaching, and now he has this resource in a book to do it on his own.
And in the end, there's always progress.
Our friends and myself have seen the differences in him because he has more energy for conversation and walking bigger, stronger.
Do the therapy. If you want to continue to be, as much as I hate to say it, all that you're going to be with the Parkinson's, continue to function as well as you can, you have to take the therapy. You cannot stop. You have to keep moving one way or another.